Health insurance costs for me and my family is doubling in 2026.
I keep seeing posts on here of people talking about dropping their insurance for the new year, and I'm really thinking it sounds like a great idea.
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks.
Hello. Welcome back to my channel. Today we're going to be talking about healthcare. The rising cost of healthcare has gotten out of hand, and people are talking about their experiences with it happening to them and giving suggestions as to what they're going to do to be able to try to combat the situation. Please don't forget to like, comment, share, and subscribe to my channel.
I choose the cheapest option, which gives me the highest deductible, and I was paying $90 bi-weekly for me and my family, and that does not include dental or vision. For 2026, it's going to be more than double for the cheapest option, highest deductible, $190 bi-weekly, and again, that's before dental and vision. Luckily, dental and vision isn't going to add that much more, and that does include my job contributing to my HSA depending on how many people I cover, but that is a lot of money for it to just double. If you have gotten the quotes for your 2026 insurance, I'm curious if yours is also increasing, because I'm hearing that a lot of people's are. I actually work part-time, so my paycheck is already very small as it is after a lot of deductions come out, so this is definitely going to change things. We're thinking about just having me and the kids on my insurance, and then seeing if it's cheaper for my husband to have insurance through his job, and just seeing if it's cheaper that way. But that would mean that any medical cost he has, I can't cover through our HSA that we're always contributing to, because he wouldn't be like a covered person under my plan. That's like nearly $400 a month for me and my family. And
$400 a month is a lot of money for medical care, just for her and the kids. Not even including the husband. It's like, forget the husband, we're just gonna do her and the kids. That's a lot of money. I can see why people are upset and they're stressed out about the situations they're currently in when it comes to medical care.
for years, we've been able to do like a blood draw that gives you money off of your insurance, but there's been no talk of that for 2026.
I'm gonna need somebody or several somebodies to de-influence me, okay? I keep seeing posts on here of people talking about dropping their insurance for the new year, and I'm really thinking it sounds like a great idea. Everybody's already paying a shit ton of money for our health insurance, and then for some reason, if we do go to the doctor or the hospital or something, we're paying more money because we have insurance than if we were to go in there and not have insurance. So I'm paying for insurance just so I can pay more money? That doesn't make any sense. People are talking about setting up a separate savings account and just putting what they would be paying for insurance every week or bi-weekly or from every check, and just putting it into this account, and then having that account for any kind of medical needs. And I gotta say, it really makes sense to me, because at the end of the year, you're normally not even having that much go on, knock on wood, but I don't know, it's making sense to me. I need somebody to de-influence me, tell me what's wrong with that plan, and every in and out between it.
So it's not a bad plan that she wants to just put money to an account and save it in case she needs to use it towards her medical care. The only problem is, every time we cut back on things, every time we make these major changes, something always tends to happen that we need all the coverage that we had before. It just be that one time when you cut back. It'd be that one time when you don't have the full coverage and you need it, and you end up paying even more money to get the coverage. So it's kind of like you have to just make that decision and just stick with it.
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family. Correct? Now, that does not include my vision, dental, 401k, or disability. So when you add all of those in, I'm paying about $550 every 2 weeks for my entire family to have medical, dental, vision. I have disability coverage, and I also contribute to my 401k. We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. That does not include my 401k, my vision, my dental, my disability insurance. How can I possibly survive paying $1,500 just in medical coverage? They already kicked our spouses off of our coverage because they said if your spouse can get insurance through their job, we're cutting them off. So not only did you cut them out, it tripled. $700 just for medical benefits every 2 weeks. I'm not even talking about a month. This is bi-weekly. How is this? And I work in medical. How is this fair? How does this work for anybody? I can literally cry. I have a daughter that's graduating college next year. I have a daughter that's getting married next year. On top of that, we have to live. How? How can anybody live spending just $1,500 a month just in healthcare that doesn't cover our dental, that doesn't cover our vision? On top of that, there's a $2,000 deductible and a 20% co-insurance. So either way, anytime we go to the doctor, anytime we do anything, we got to come out of pocket. On top of what I'm already paying. When in the fuck is this nation supposed to be great again? Because it's getting worse.
Paying $1,400 plus per month for medical insurance is insane. That's a mortgage in some places. Things are getting really out of control nowadays, and I think when everybody thought that things were going to be getting better sometime soon, they just start wrong, because it just seems to keep getting worse and worse and worse. At this point, it probably is better to just not even have coverage, but it's hard to say that because if something happens and you don't have it, you're really going to be screwed. Right now, people are going to have to just do the best that they can. Some of the people making suggestions about putting money into an account and having it for later on medical care really wasn't a bad idea, but it's just kind of hard to know because you don't want something to really happen to you, then you can't afford it and you don't have enough to cover it. Right now, everybody in America is in a really bad state when it comes to just living, period. Thanks for watching this video. Have an amazing day.